So what are your thoughts on the effectiveness of Urolift versus a TURP to improve urinary flow?
This is a fascinating area that is difficult to sort out. Urolift is where they pin the prostate open to help men urinate better. Is a convenient outpatient procedure. That makes it very attractive. It's not as effective in men with really large prostates, and so TURP is going to work better in those individuals. Transurethral resection, or TURP, is an operation, and with all the negative things associated with operations. And, there's complications, bleeding and whatnot. But transurethral resection has been around for years. It's an established mainstream way to try and help men with slow urination and urinary problems. So Urolift, attractive because of its convenient, outpatient, and if the prostate's not too big, it might be a good first step.
So for this patient, he had Urolift, and I'm guessing he may have had a big prostate because he says the Urolift didn't work. So now he's saying, should I get a TURP procedure, or is there anything else he should do?
Well, we usually start men off, and I'm assuming he's been through this process of various medications to try and relax the prostate or shrink the prostate. And once those pharmaceutical approaches have become demonstrated to be ineffective, then you start thinking about TURPs, aquablation, HIFU. There's another treatment called Rezum. And these are all different interventions that can be quite effective. You want to find a doctor that's done that particular procedure a lot. It'd be nice if one doctor could do all of them and say, well, for your particular situation, you'll be better with Rezum or Urolift. But usually what you encounter is these doctors develop skills in doing one thing. And so then it's left up to you to decide, do you want to go get a TURP? If so, maybe I'll go to this doctor. And if I want to get a Rezum, I'll go to this doctor. And so it's hard to find an unbiased source as to which procedure is best. And then, of course, once you've made that decision, kind of like for any kind of prostate treatment, then you've got to find a maven, a really talented person that's done a lot of that.
So, we've talked about in different types of treatment, finding the person who's done maybe read 1,000 MRIs or done 1,000 treatments. Would you say, how many procedures would you say for something like HIFU or Rezum or any of these, they should call the office and ask how many of the doctor has done?
Yeah, I think so. 50 to 100 would be nice. What kind of training did they get? And what type of online reviews do they have? It's what do the support groups say about these and the types of results that they're getting? If there's a primary care physician involved who's referred that doctor a lot of patients, what kind of outcomes is he seeing in the patients that he's referred? So there's different ways to do homework. None of them are perfect, but you definitely want to be thorough because when you enter into a procedure, sometimes it has irreversible consequences.
No, I really appreciate you mentioning all of that because I think, we always talk about patient empowerment, but I don't think patients know they can call and ask those questions because a lot of time it's the doctor, they're the expert, who am I to call? Well, you're the one it's being done to. And
Right.
So I think that's an incredible concept and it needs to be applied in many cases. Talking about unbiased opinion, we hear Rezum is steam, Urolift is obviously pinning back the prostate. If you had to put those in a certain order, what would you do?
The Urolift stands apart because it's an outpatient procedure and they're not cutting any tissue out. So if it's feasible in the judgment of the doctor doing the procedure, then that would probably be the most attractive first step. I always like to take baby steps before committing to a bigger procedure where it may have a more durable effect, but it also may have permanent side effects if things don't go well.
You mentioned a series of pills that they can take in order to shrink the prostate. Can you list those for the audience?
Well, there are many of them. The alpha blocker categories like Flomax, Uroxetrol, Rapaflo, and then you have the Cialis, Taldenafil, which is effective. You have the antispasmodics like Myrbetriq and Toviaz, and then the prostate shrinking drugs like Proscar, which is called finasteride or Avodart. So they all have their pros and cons and side effects and different roles, and they can be used in combination.
Do you have one that you use more than another in the office?
Well, people have different needs. Some people have bladder irritability. Some people have blockage from the prostate. Those are different medications to help with those situations. But I'd say a very popular product is the Flomax, or tamsulosin is a generic name. Generally well tolerated, and if it works very quickly.
Hi everyone, it's Alex and Hunter. Hunter's our official PCRI mascot. If you'd like to learn more about men's health tips and prostate cancer, you can follow him on Instagram, Sir Hunter the Dow, and also subscribe to our YouTube channel. We come out with new prostate cancer videos every week. Say bye!